Hi guys, this is Dr. Samaliazad. Today we're going to go over the digestive system structures and discover some of the important structures that are associated with such a long organ or the system that we have. So starting from the top, that as the time that you put the food in your mouth, it's going to be entering right into the oral proper. From there finds its way to the back side. The area that connects the oral cavity and allow the food goes to the bottom part, this little section is known as the fauces. It's a narrow part which food and drink has to pass through this section before it gets lower than that. From there, it's going to opens up to this section known as the oropharynx, and the oropharynx is going to find their right way to the laryngopharynx. Of course, this is epiglottis. Is a cartilaginous tissue that falls over and closes the trachea so the food cannot enter right into that part. And the upper section, we have the uvula, which backward goes up and close that part so the food cannot go to your nasal part. Couple of structures that on back of your throat are associated with the digestive, not really, but because since they are located there. One is known as a palatine tonsil, that you can usually see him sitting on the back of your throat when you have an infection. And there is a one that is sitting right down here known as the lingual tonsils. So as the food comes down here to the oropharynx, passes to the laryngopharynx, it has to pass through the small opening. Remember, the esophagus is a collapsible tissue or a tube that is not open. It has to be open so it can accommodate the weight of the food as it goes all the way down through this section, which is, this is your esophagus. The upper part here, there is a small sphincter known as the upper esophageal sphincter. From the upper esophageal sphincter opening, the food is going to find its way all the way down to the esophagus and ultimately bringing everything to this large cavity which is known as stomach. Right the area which connects the lower part of the esophageal and produce connection with this stomach, there's another sphincter here known as a lower esophageal sphincter or cardiac sphincter. The reason that they call it cardiac because of the location of the heart that is here. So either name are going to be correct name. Anatomical structure of the stomach, when you're looking at it, look like a J structures. That's what they call it, the J-shaped structure. The upper part is known as a fundus, which is this kind of dome-shaped structure there. Then you can get to the body part and ultimately the pyloric section right there. And the end of a pyloric is going to be attached right into the small intestine. It has two curvatures. One is known as a greater curvature, the other one known as the lesser curvature right here. Opening this thing and looking into the region, you can see these folds. These folds are known as a rogae. The function of rogae is that they just increase surface area. When your stomach is empty, these rogaes are a little bit more prominent. As the weight of the food accumulates in there, they kind of become separated and also become less visible. As the food passes through the body and gets to the pyloric region, it's going to find its way through these sphincters that are here, known as the pyloric sphincter, and pass through this opening known as pylorus. And from there, it's going to get to the first part of the small intestine known as a duodenum. Duodenum is only about 10 inches long, so it's not a very long extension. But looking inside of the duodenum, you can see the presence of this roughened region. These are known as the plica circularis, because now this is the area that the absorption starts to occur. Then from there, it's going to be going to the second part of the intestine, which is known as the jejunum, and ultimately to the largest portion, which is the last section of your small intestine. That one is known as the ileum. Ileum brings every content and ultimately release everything into the colon or the large intestine. There is a sphincter located in this area, which opens up and allows the content of the small intestine finds its way right to the large intestine. This sphincter here is known as the ileocecal valve or ileocecal sphincter. Inferior to this sphincter, you have this cul-de-sac, which is known as a cecum. And extending from the cecum is going to be your appendix, right there. From there, if you go up from that section, that from this cecum part all the way to this area, which is alongside of the liver, you will see the colon suddenly make a 90-degree angle toward the left and start going across the abdominal region. This little angle here is known as the right colic flexure. Also, since the same area where the liver is, we call it hepatic flexure. From there, the name changes, becomes transverse colon, and the transverse colon ultimately is going to go all the way to the other side and again make another 90-degree angle and start going inferiorly alongside of the left part of the abdominal region. This angle here is known as a left colic flexure, and since the spleen is located right there, also they call it splenic flexure. Ultimately, the descending colon starts from there and is going to go all the way down and turn into the sigmoid colon and to the rectum, and from the rectum as it comes all the way down to the anal canal and allow the substances to be going out. So we're going to look at this structure here in a little bit more detail that you can see right on this model. If I remove that part, you can see the location of the stomach. If I remove the stomach, you can see the colon and also small intestine. A couple of things that I need to talk to you guys about the colon is presence of these pouches that you can see. There are a lot of them located there. They are known as the haustra, that alongside of the region that are going to be sitting. Then you have this layer of the muscular right alongside there. If you look on this one, you can see them that is throughout the region. This is known as a tinea coli that is associated with the large intestine, and these are the muscular bands that are everywhere alongside of the entire length of this tissue. Now, the abdominal contents that you can see, they are not just sitting there. They are attached to retroabdominal cavity by way of some ligaments. One of those ligaments is the one that allows the connection of the colon to occur. This one known as the mesocolon. So if I remove the small intestine, you can see the mesocolon that will keep the large intestine in place and also make sure that it's sitting properly in its area. The other one that is associated with the small intestine, this is the one that is known as the mesentery. Mesentery, you can see it is like a fan-shaped triangular tissue that keeps and attaches the small intestine right to the retroabdominal cavity and make sure that it stays in place. So, if I remove these structures from here, you can see the angle here. This is a sigmoid colon that sits right in this area and ultimately go there. Of course, not to mention, this is the bladder location there. Now, there are a couple of organs that we're going to be talking about, which are known as accessory organs of the digestive system. One is going to be this guy, known as the pancreas, that is located right behind the stomach. If you look at it here, the stomach is sitting in this position. So the pancreas is right underneath it. And this pancreas has three parts in it. The first part is known as the head part, which is in contact or sitting alongside of the C-shaped part of the duodenum. Then has the body and the tail, which is in contact with the spleen right there. What this structure is going to do is going to release a substance. These are alkaline substances that has endocrine activity. Of course, we know pancreas has an endocrine activity as well, which releases insulin and glucagon. But in this case, we're going to be only talking about the exocrine activity of it. You can see right down the center, this is known as the pancreatic duct. pancreatic duct is going to be releasing its content right into duodenum. So let's look at them here on this structure, which is a little bit larger and easier to be able to see. So this is the pancreatic duct, okay, which also they call them the duct of Wirsong. As it comes down here, toward the end, before it releases in contents, which are alkaline substance to neutralize the acidity food that has just received to the small intestine, is going to be receiving some of the bile that is going to be secreted from the second accessory organ of digestion, which is known as the liver. Look at this structure here. This is the liver, and you can see the gallbladder that is sitting right down there. This is the bigger part, or the fundus. Then you have the body and infundibulum, part of the gallbladder. And the gallbladder is an area where the bile produced by the liver is nothing more than a reservoir, which is storage, keeping it, and during digestion is going to be sending it out. It's going to come out by way of the cystic duct. As the cystic duct will come down, it's going to be receiving from the right and left hepatic duct, is going to be receiving the content of the liver, and ultimately produces common bile duct. The common bile duct will come right in this section and is going to be combining with this pancreatic duct at the region which is known as the hepatopancreatic ampulla. You can see this area is a little bit enlarged. On either side of that, there's a small kind of a sphincter or valve which control how much substances are released here. That sphincter is known as a sphincter of Oddi, that is located there, and ultimately everything is going to be released by way of the major papillary part of the pancreatic. Through this papilla, everything is going to be released right into this section. Also, it has another type of a duct which comes up right off the main duct, which is this one, pancreatic duct. This one is known as accessory duct, sitting here. Also, the other name for it is known as the duct of Santorni. Duct of Santorni releases content through the minor papillae, which is sitting right superior to this ampulla, to the small intestine. So you can see them here a little bit better. You can see this is a major and this is the minor duodenal papillary. The major one gets everything from the main pancreatic duct and also common bile duct through the sphincter of Oddi, but the minor duodenal papilla is going to be releasing everything through the accessory part. Here you can see the gallbladder a little bit better. This is a fundus and body, and this is infundibulum. Cystic duct receive everything from the right and the left lobes, produce together common bile duct, which is going to be releasing their content right there. Now, looking at the liver itself, we have a couple of structures that are we going to say. It composed of two lobes. From the top, this is known as a falciform ligament, which is attached to diaphragm and keeping it together. Then, on the bottom part, you can see this is a ligamentum teres, or the round ligament, which is a remnant of the fetal blood vessels. It's divided into two lobes. This one is known as the left lobe. This is a right lobe. The left lobe, it has a couple of parts in it. This section here, which is in contact with gallbladder, known as a quadrate, and this section down here is known as caudate part. And that pretty much covers everything that you should know for the identification of the digestive structures. Thank you for watching.